I'll show my TAFE ID card. So this is I'm Alex. I'll be playing the trainer. That's my TAFE ID card. And with me, I've got Cam, who will be the learner for this training session. Welcome, Cam. I'm Alex. I'll be your medical trainer.
Awesome.
How are you feeling today?
Very good. Yeah, very excited to learn.
Perfect. So welcome to the training session, how to prepare 10 ml sodium chloride 0.9% flush. Do you know anything about a sodium chloride flush?
No, not at all.
No worries. So sodium chloride, it's an isotonic solution. We use it a lot for many things in medical. With the sodium chloride flush, we mainly use it for flushing IV cannulas. So they're like the needles in the veins that go into the arm that we have IV therapy, like medications, antibiotics, and fluids. So we have flushes. They are used to flush the cannula to make sure it's patent. So we have to make sure that we are able to prepare a flush to the safe and correct standard for the workplace. Does that make sense? Yeah. So the training outcomes for this training session is, one, you're going to learn how to prepare a 10 ml sodium chloride flush correctly and safely. You're going to be able to identify the uses of a flush, and you will be able to perform and demonstrate safe needle handling, because with drawing the flush, you are dealing with drawing up needles. They're not super sharp like a regular needle that you would inject in an arm, but drawing needles are a lot thicker, fatter, still considered sharp. So it's something we've got to be aware of.
Okay.
So the way this training session is going to go through is I'm going to demonstrate the skill first. You'll observe me, watch it. If you have any questions, just ask me.
Okay.
Then we'll do the skill together, you and me side by side. That way you can learn how to do it with me showing you. And then third, would be you doing the skill independently, and I'll be coaching you throughout the way, providing you tips and feedback.
Okay.
Any questions so far?
No, it's all very straightforward.
Excellent. So the first thing we have to do when entering the workplace is safety. So work health and safety considerations is something we always have to be aware of whenever we perform our tasks, to ensure that we do it to a high professional standard, as well as safe for ourselves and the patients. So when it comes to the clinical area, you're going to make sure you have enclosed shoes, because it is a clinical area. You can have things that fall, spill, splashes. And when it comes to the preparation of the flush, you've got sharp needles, so we've got to be able to handle these safely. That's another work health safety consideration. And you also have to have safe disposal, which would be the sharps container over here in this corner, in the yellow puncture-proof container. Any questions about work health safety so far?
Yep.
Perfect. So I've got a few training resources. The first one is a poster about safe needle stick handling and sharp safety, and just a hand hygiene alcohol-based hand rub poster, just to remind you how to do an alcohol-based hand rub. And I've just got a few copies of the policy when it comes to drawing up medications. Okay, so the first one we'll go through is needle stick safety. So there's 5 tips you need to be aware of. First one is you don't force sharps into the container. You don't put fingers inside the container. It's pretty obvious.
Yep.
And you don't remove the needle off the syringe. So once the needle's in, you're not supposed to remove it. It's a bit different when it comes to drawing up a flush, but that's just a general rule.
Okay.
Don't bend the needles, and don't recap needles. So you shouldn't be recapping needles, with you holding the syringe and the cap.
Right.
So that's some safety. So that's there just to remind you.
Okay.
Hand hygiene, whenever you do procedure, you always have to perform hand hygiene. When it's a clean procedure, something like this, you don't have to do a hand wash. You can, hand sanitizer is fine. And that's just the person reminding you of how to do the alcohol-based hand rub. So that's a training resource we have as well.
Okay.
There's a few policies that you need to be aware of when it comes to this. So when it comes to drawing up the sodium chloride flush, it comes under our infection control standards. So a lot of times you'll find a lot of nurses, they've got your 10 ml sodium chloride flush and they've got the syringe. Now, they like to connect the ampule to the syringe directly and draw it up. That's an infection risk because that's dirty, it's not sterile. So the policy says we've got to always use a drawing up needle when drawing up any medications. Even though it's a sodium chloride, it's still considered a medication because it's going through the vein.
Right.
Any questions about that policy?
No.
Yeah, so look, it's a gentle reminder, if you see someone in the workplace that's not doing it correctly, just remind them that's not the right way and they should redo it with the syringe because it is patient safety.
Got it.
Okay. So, the first outcome you had to learn about was identifying the uses of the flush. So like I said, we use flushes throughout healthcare. Most notably, it's for flushing cannulas to ensure they're patent. We do flushes every 8 hours for an IV cannula on a patient, just to make sure it's patent. We also do it before administering medications and after administering medications. So that's the uses of the flush. Now, task breakdown. So I'll be doing, briefly explaining to you. So you gather the equipment. The first equipment is the sodium chloride 10 ml ampule, and you got to make sure it's in date. So it is in date. You're going to need to have alcohol wipes, which is something you'll use before administering. You'll wipe the cannula and then administer. But in this session, we're learning how to prepare. So you'll need this for preparation when you go to the bedside.
Okay.
Drawing up needle. The 18 gauge needle, we've got a red cap, so it's easy to see. And you've got your 10 ml syringe, sterile in the packet, make sure it's intact, and that is in date, which it is. You also need your hand hygiene, which is the alcohol-based hand rub, as well as your sharps container. Now, the other thing you'll need for training is just a kidney dish or a vessel to hold your finished product up, which is over here. So when you prepare the flush, you put it in the container so it's clean, you bring it to the bedside with alcohol wipe, okay? So that's the other equipment. So, I will be demonstrating first, so watch closely. So you're gonna perform hand hygiene first. All right. And the other thing is, any hand drill, you better take it off, especially if you're ready. So I'll take my watch off, perform hand hygiene, and just make sure that your hands are dry before you start touching the stuff.
Okay.
Now, with the aseptic technique, what it means is you're not, touching the ends. You're not touching critical components that will be touching the patient. That's aseptic technique. So it's a non-touch technique. You're not touching the tips of the end. You're keeping it in the air, sterile, aseptic. Okay.
Okay.
So you're gonna get your syringe. Open it up. So I can hold it like this. It's just not touching the end. Okay? You keep it in the packet so it's still kept safe. You got your needle. So I like to put that in one hand in between the fingers,
Okay.
like that. And you got your sharp needle. Again, that's a critical component, don't touch it. So that's your needle. Now, you get your syringe, you get your needle, you attach it together. It's a Luer lock system. The Luer lock syringes are the ones we use in the workplace. We don't use the slip lock, it's the Luer lock. So it's the same one we're using the equipment. So that's your syringe prepared.
Okay.
Now, we don't have any fluid in there. Our next job is to drop the 10 mils of sodium chloride. So you get your ampule, you check that it's in date, it's the right drug, which it is. Crack it open, away from you. Don't touching the tip. So take the cap off. Now, with the cap, always leave it on the bench. Don't discard it because we need to recap it, but we're going to recap it a safe way. So keep the cap, one hand with the ampule, one hand with the syringe, gripping it with your index finger and thumb. I like to sort of release it first so that it's loosened. We're going to carefully insert the needle into the ampule and just slowly draw out the fluid. Making sense so far?
Yeah.
I've drawn out the entire contents. So ampule goes down. Now I've got the sharp. So you don't want to be around many people. If you've got lots of people around, you've got to say sharps out so we know you've got a sharp. So you've got a sharp needle. Now when recapping, we're not recapping in. We've got to leave it at the bench and aseptically put it back in, scoop it up, it's capped back in. So that's our flush prepared. Goes in the kidney dish along with one alcohol wipe. And best practice is always to keep the ampule, take it to your second nurse, get him to double check that it is the right drug, in this case the right sodium chloride that's in date, it is what it is, before going to the patient to flush the cannula.
Yeah.
Okay? So that's how you prepare a flush.
Okay.
Ready to do it together?
Yeah, let's do it.
Alright, so step one, hand hygiene. Do you want to pause it quickly or?
Yeah. Yeah, sure.
Okay.
Pause it real quick, just real quick.
No worries, I'll pause.
Cool.
Okay, so you perform the hand hygiene. So
Yes,
you're gonna
okay.
grab one syringe.
Okay. This one?
Yeah, one syringe. I'll grab a syringe.
Yep.
And you're also gonna grab your needle. Now, let's open up the packet. Again, aseptically. Yep, you're doing great work. Okay, put that in one hand and then you've got your needle. So open up the packet of the needle. Yep, feel it gently. Perfect. So are you right-handed?
I am right.
Yeah, so keep your right hand on your with the syringe and the left hand with the needle.
Okay.
Yep. Now we're gonna take the syringe out of the packet. Yep. Perfect. And then now we're gonna connect the syringe to the needle, the lower lock system. Okay. Now we can take it out. Put the packaging to the side. So now we've got our syringe. Make sense? Okay. Now you're going to grab one ampule, crack open the ampule, yeah, twist it right, yeah, that's it, and then we're going to grip the I like to grip it like this, it's, as long as it's an aseptic technique, yeah, with your thumb and index finger, grab the cap, uncap it, leave it on the bench, yeah. Now we're just going to carefully insert the needle into the ampule. You can invert it upside down because of the pressure in the way it's done, like it won't leak.
Okay.
And then just slowly draw out the fluid from the ampule. Yeah. So you can pop your thumb on the sort of that grippy bit down there. And you want to bring your needle sort of closer down to the bottom, so you get all the fluid. Alright, great work. Yeah. The ampules actually contain 12 mils, so
Okay.
that's excess wastage. So that's alright.
Okay.
Now, like I said, with the cap, so grab your other hand, the cap on the edge like how we've done.
Yeah.
Yeah. And then just carefully put the needle into the cap and lift up. Perfect, and then you can now close the cap. Congratulations. Now you've got air bubble. When you go to the bedside, you can push the air out or you can push it out. It's up to you.
Okay.
Because you don't want to be pushing in the
Yeah.
thing.
Yeah.
Perfect. Excellent. In the kidney dish,
Yeah.
so that's ready to use. Cool. How was that? Do you feel comfortable with that? Any
Yeah,
questions?
no, very comfortable, very straightforward. Yeah.
Great. So, next step is doing it by yourself.
Okay. So,
Any-
sanitize again? Or?
Yeah, I'll walk you through it. If you have any questions, I'll
Sure.
guide you and I'll provide you feedback. Yeah. So, hand sanitizer, excellent.
Cool.
Alright.
So I take my syringe or the
Yep,
needle.
syringe.
Good stuff.
Yeah, no, that's all good. Yeah. Perfect. Don't take it out yet, just leave it in the packet. Grab your needle now, which is the red.
Yeah.
Yeah. Open it up. Perfect. Now you can take the syringe out. So switch hands.
Yep.
Yeah, that's it.
Take it out.
Take it out. Drop the packaging and then connect it to the lower lock system. So you're gonna push, twist. Perfect. Great work. Now you can take the plastic off. Now you got a syringe. What's the next step?
Then I'm going to get the vial.
Yes. Yeah, correct. So get the ampule, crack it open. So yeah, twist. Perfect. Now, what's the next step?
I need to remove the
cap.
The cap.
Now, what's the important thing about the cap? We don't discard it. We need to make sure we keep it right.
Yeah.
So yeah, you just place the cap safely on the, just slowly on the bench. So just pull off. Yeah.
That's it like that.
Yeah.
And then we.
Now you can draw up the fluid aseptically. You can also tip it upside down. Yeah, that's fine. And then just slowly pull the plunger and just bring out all that fluid. Perfect, and that's 10 mils. So you can take that off.
Just this.
Yeah. Now with recapping, what did I say about
We
the
have to line up this.
yeah on the edge
against
of the bench?
and
Yeah.
then not touch it.
Yeah.
You can line
That's the way.
it up. And
Perfect. And that's capped.
Yep.
Place in the kidney dish. Bring it along the alcohol wipe to the bedside, and then you've prepared a flush.
yeah, and then you have someone else check it to make sure that.
Yes, correct. With the ampule, that's the best practice.
Yep.
Well, how did you feel? How was that?
Really good. It's really good to learn a new skill. It's
Absolutely.
very straightforward. It's
Yeah.
good to learn. Yeah.
Any questions about the skill or the process or anything about the skill?
No, it's pretty straightforward. I've understood it.
Okay. Well, why do we need to discard sharps in the yellow container? Why can't we just chuck them in the regular
Because
bin?
someone else could just reach in and poke their fingers, or someone getting rid
Yes.
of the garbage. Could
Exactly
poke
right.
themselves
Work
and
health
discard
safety.
it. Yeah.
Correct. And it's puncture proof. It's yellow. People know it's danger, so they won't stick their hands in. Goes back to the needle stick safety, the sharp safety.
Yeah.
Why is it important to use aseptic technique when drawing up the fluid and preparing the flush?
If you touch it at any point, it's the way it's manufactured.
Yeah.
It's sanitary. If you
Mm.
touch it with your hands or anything else like that, you can put some bacteria on it,
Yeah.
which could then get into the needle, get into the patient.
Correct, and that will then cause a healthcare acquired infection.
Right.
Very good, Cam. So, congratulations, you now know how to prepare a 10 ml sodium chloride flush safely and
Right.
correctly. So, this skill, you'll be using this every day in your clinical practice, and now you'll be able to prepare a flush, use it to access peripheral IV cannulas, vascular access devices, make sure they're patent. So yeah, really good job. You've done really well, you've maintained the aseptic technique. Skill-wise, I think you're competent at it. A bit more practice, you'll be able to perfect the skill.
Yeah.
You're all a bit shaky, but that's expected when it's your first time. But overall, really happy. You've maintained safety, you've done all the correct procedures, you've maintained aseptic technique. Very happy with that.
Thank you so much. Thank you for teaching me.
No worries at all. Thank you, Cam.
Thanks. Thank you.
Thanks.
No problem.